So my name is Shadia and I'm from Rochester, New York. And I'm here because I've been dealing with 11 years of chronic pain. The most, crucial pain or ailment that I deal with is not being able to stand and walk. So my standing is about 5 seconds and my walking is a couple minutes right now. I was able to walk for about 20-25 minute increments, but then it got worse again in the last 9 months. As soon as I tried to just stand, I have severe pain in both knees, down both shins, and in my lower back, to the point that I feel like I'm going to collapse if I don't sit. And my walking, I couldn't walk for the first 3 years, more than a minute, and then I was able to start walking after some treatments that I had from chiropractic, about twice a day, 20-25 minute increments, and then since July of this past year, so it's I think 8 or 9 months now, I'm back to where I can only walk for a couple minutes. I have a lot of pain in my right knee especially. It's both knees, but even more so in the right knee in the last 8-9 months, and a lot of pulling in my muscles all around my legs. So the pain will get pretty severe. It can shoot up to an 8-9, and I'll have to stop walking after a couple minutes. Just sitting right now, I have pain in my right knee more than the left right now. I'd say right now it's probably a 4 or 5. Over 40 doctors in the last 11 years. I have seen, of course, my regular primary care physician, 3 orthopedic surgeons, several chiropractors, neurologists, a couple of different neurologists, rheumatologists, I think 3 different rheumatologists, endocrinologists, not only chiropractors, but massage therapists, trigger point therapy, myofascial release, acupuncture, regular physical therapy, several dentists, naturopathic doctors, I don't know, so many. I saw three different ones. They even did MRIs of my knees and they came back normal. They sent me to regular physical therapy and they released me after a couple weeks and said something else is going on. Second right now is actually a more recent issue I started dealing with 6 weeks ago. It is really bad, severe nerve pain in my elbows. It started with the left elbow. And it was right severe in the elbow and then running down into my 2 baby fingers as well, to the point that I could barely use my left arm to drive, to do dishes, to even to chop food, anything. It's just excruciating. And even just trying to sleep at night, having my elbow rest on the bed is severe. And then about 3 weeks ago, the right elbow started as well. So I've had days where it's literally been a 9 or 10 recently. I have gotten it down a little bit in the last 2 weeks from taking a lot of magnesium and removing a couple foods that I noticed were bothering it as well too. Third thing that really bothers me is my neck and shoulder pain. I have constant, for the last 10 years, constant pain that runs down the back of my neck into all my shoulders and really bad in my shoulder blades. And if I try to not look forward, if I try to look to the side and talk to somebody, or look up to watch a TV, or talk to somebody looking up for a few minutes, all of this will just immediately tense up. So even watching TV has to be completely eye level. I can't look down to read a book, or even when I start to write or go on the computer, immediately actually the pain will start to go down my entire arm, my right arm, and all my neck and shoulders will tense up really, really bad. So on a normal day just sitting here, it's constant tension. I'd say it's a 5 or 6, but when I again go read a book or try to go on the computer or look down on my phone, it can shoot up to a 9, I'd say. So I have major gut issues I've had for the last many years, I'd say the whole time, the last 10 years or so as well. A lot of acid reflux I was dealing with initially, and then tons of bloating constantly. My stomach is always bloated, and I have major food intolerances in the last 1.5 years. I got down to 22 foods that I can actually tolerate that wouldn't cause severe pain in my body. The foods were causing severe sit bone pain. The bones that you actually sit on would burn, the back of my heels would burn, I get headaches, and now I think it's even bothering and causing elbow pain, nerve nerve pain in my elbows as well too. Okay. The rheumatologists have checked all the autoimmunes and they came back negative. I just had a high inflammatory markers, ANA and CRP. They of course diagnosed me with fibromyalgia. I've been told possibly Lyme disease, but when they do the testing, they all came back negative. One came back half positive, half negative, so they weren't sure. And besides that, they have no clue. They did find a major infection. I had 2 teeth that were pulled back here 7 months before all my symptoms started. So tooth number 1 and 2, the top molar and the wisdom tooth behind it were pulled. And 7 months later, I started getting light sensitivity, sound sensitivity, heart palpitations, muscle weakness, and then 1.5 years after that, couldn't stand and couldn't walk. So the dentist specialists did find that there was a major cavitation here, but then when the cavitation was removed, nothing else went away. So when they numbed this area of my mouth where those 2 teeth were pulled, right here, number 1 and 2, within 20 seconds or so, all my pain in my body completely disappears. And I actually feel heat that hits my legs. The pain that's in my knees literally just dissipates completely. And I can stand and I can walk completely normal the entire time I'm numb. I'll have full range of motion of my neck. It's not restricted like it is now. No pain in my back. I literally feel like I'm 15 years old. So that's like a major thing. Dr. Dwight Jennings put a mouthpiece in my mouth, and immediately, as soon as he put the mouthpiece in, my leg pain shot through the roof. And he said that was really good because there was a correlation to my leg pain. So he had to adjust it, and over the week, and by the end of the week, I was standing for about 10-minute increments. The problem is that about 1.5 weeks, 2 weeks later, it wouldn't hold. The improvement would go away, and I had to come back after 30 days. The same thing happened again, and I just couldn't financially afford to go back and forth to California every month for a couple years. I also saw another dentist, I think it was 2016, Dr. Gerald Smith in Pennsylvania, and he said also that my bite had collapsed from all the teeth that were missing in the back and that my bottom jaw was protruded backwards. So he had temporarily just given me a mouthpiece to just give a little bit of height to my jaw, and as soon as he put that in that night, I had no neck pain, shoulder pain at all, was completely gone. All the nerve pain that would go down my arm normally if I tried to look on my computer or my phone, I didn't have any of that. I could look my neck up and watch TV in the hotel room that night with no pain. But then the next morning I woke up and it was all gone again.
Widthwise.
Yeah.
Bite down on your teeth, arms all the way up, a little bit higher, a little bit higher. I'm going to push down, don't let me. Bite down, be like a stable. Bite down tight. Well, then take long at all. Bite down tight. Okay. Very good. Have a seat. I'm going to place this here, so we can do the sitting down. Just a second. Bring your teeth into the indentation. Okay, you got it in there? Now go ahead and stand up. Okay. Arms all the way up. A little bit higher, a little bit higher. Bite down on there tight. I'm going to resist me the best you can. Bite down tight. I'm having to make some work. Bite down tight. How about the knee? Knee feels good. Bite down tight. I'm using 2 fingers. Bite down tight. Bite down tight. Bite down tight. Bite down tight. What you crying? Open again.
It has to be from there. It has to be from the jaw.
How much better? Are you feeling more balanced?
Like a lot better. Like a lot better.
And your knee didn't hurt? I was using quite a bit of force. And if I were to use the same amount without anything in there, let's see. Hang on a second. Let's try that again. Stand up here. Go ahead. I hope it's a happy cry.
Yeah. Holy crap.
Go ahead and stand up one more time. And have your arms all the way out. Put your back teeth together normal. I'm using 4 fingers like I did before. Not even close. Not even close.
And my knees hurt.
Okay, the knees hurt. That time. Okay. All right. Brain doesn't take a long time.
Holy shit.
No, go ahead. Holy shit is the right word for this one.
It's instant. Like, instant strength, and my knees are like...
Made you more balanced.
Oh my God.
It almost felt like the old Shadia, huh?
Yeah. Holy shit. I'm in shock. I'm literally in shock because I didn't think it would happen that quick. I didn't think it. I thought literally it would take like weeks or months to see a progress. How is that possible? Like, and within seconds.
Not even seconds, fractions of a second, fraction of a second. If you get to the root of the problem,
oh my God,
as opposed to guessing. That's why we put you through so much to measure and all those things to get it there. Then it seems, for some people, like miraculous. It's not a miracle. It just
I don't like want to do
lot
it
of data.
again.
Huh?
I want to do it again. I want to like.
Want to do it again?
Yeah.
All right, go ahead.
Can we put it back
Yeah.
in? It's like unbelievable.
Just a second, just a second, just a second. Now bring your teeth together. Okay. Go ahead and stand up. No, nothing. I'm just having you stand up. How does it feel? And we can talk. Does it feel more stable? Stability, balance, and then make you stronger. Arms out. A little higher, a little higher. I'm going to use my little finger. Bite down tight. Don't help me. Bite down tight. Bite down tight. Bite down tight. One more time. Open again. What is that?
I said it's crazy.
Good crazy.
And literally, as soon as you take it out, I can start to feel my knees like.
Well, when you had it there, you're okay?
Yeah, I feel a little bit of pain. It's not completely.
Not the pain
gone.
part, as far as feeling
It's,
stability.
No, stability. But as soon as you take it out, it's almost like
I unplugged
all
you.
the inside here just starts to like. It's all. I can feel it creeping in more and more and more, and then it's like I have to sit. I have to sit.
Hopeful.
Unbelievable.
I'm in just complete shock and happiness right now because I have not been able to stand for 11 years, and I'm standing. I'm standing as soon as this fixed orthotic went in. I'm able to stand right now. Like, I can't even believe this right now. I feel taller. I feel like more stable. And I have really severe pain in my knees for 11 years to the point that I could not stand for more than 5 seconds, where I would just feel like the pain is so severe in both my knees and my lower back that I have to just sit immediately. And it's not that I don't have any pain in my knees right now, because I do have a little bit, but I can stand. Like, it's not excruciating. And actually my lower back, like, I don't feel anything in my lower back right now at all. Not this quick, no. I was definitely not expecting it this quick. I was thinking maybe, you know, hopefully by the 90 days I'd be able to stand again, you know, and maybe I'd see improvement within 30 days or 60 days. But the fact that, like, I don't know, this is crazy. Thank you. Thank you, Dr. Raman, and thank you, God, for leading me to him.
It shouldn't hurt to smile when your bite is aligned. You're feeling fine.